Thank you.
I forgot what I was going to say. You know what you said is really important. I mean, I sat on the PT advisory committee for a long, and the OT advisory board, and you kind of feel like you're on an island. And I have not talked to people in the medical board yet, but I would bet that they might actually appreciate everything you just said.
I think the medical board does a great job. I think the providers in the state are doing a great job. I think most hospitals and healthcare systems are doing a great job. There are outliers that we have to be able to identify, is all I'm saying. And I think the way we can get at it is through a committee that will be able to understand the process and maybe make recommendations and maybe not. But if the only recommendation that came out of it was the Board of Medicine is understaffed and cannot handle the information that is given to them, that would be one thing. If the reporting from a healthcare provider's office or an institution or a hospital, whatever, is inadequate, we have to understand what is it that the bare minimum has to be reported and by whom from these institutions. Maybe not from the CEO's office, not from the C-suite. Maybe it comes from the medical review board in the hospital. Maybe it comes from the quality review boards of any hospital or practice. But we have to better understand how the process happens, how the information is garnered in the healthcare setting, and then given to the Board of Medicine to make determinations, and also to assist them in understanding the information and getting to the bottom line. And therefore, recommendations to the oversight, HHS oversight, could then possibly be made. So that would be my 2 cents.
I totally agree. And I don't know what the process of this is, but about making motions as a committee, do we need to make motions or do we just say that that's our? Okay, how do we do that? Oh, so there's a note that comes out of this.
It's a folder.
Oh, okay.
One thing, having the idea of a thing 15 minutes before the full committee meeting, I think Representative McDonald's already planned one based on, so we'd have to be careful about that. Otherwise, and that one, that's on the organ donation.
I would say at this point in time, given the gravity of what can happen with an outlier, I don't disagree that most of it probably works fine. But we're dealing with what happens when we have outliers. And what's the process to identify an outlier and what's the process to report that? And right now, I don't understand it well enough to begin to understand what needs to be done. To have somebody from an agency come and saying they solved the problem, everything's fine, I'd like to have the committee explore more into that and understanding, okay, what did you do? Do you need more resources to the Board of Medicine? What's the reporting requirements? And that's what I'm trying to get to. I think the committee can tease those things out that you would not have otherwise.
I would fully agree and support that, because I also think that regardless of what comes out of OPLC's testimony, if they were to present to us, I still think we would want to have a committee that can say, okay, thank you for that. You've done a great job. You've updated us, but we still need to understand better the processes within the hospital, in the reporting system, the Board of Medicine, their staffing, what do they need for support, et cetera, et cetera. It's going to sunset by this 3/22 in 2 years anyway, but at least maybe we'll get some information. And again, my concern is just bottom line patient quality care. And I think, like I said, I think that most providers, most healthcare organizations, the Board of Medicine, everybody involved taking care of patients in this state does a great job. I just want to protect us from the outlier, and also to bring back trust for the public to healthcare and to the Board of Medicine.
If I could add a comment, I think one of the comments that I've heard over and over again, whether it's deserved or not, was a lack of faith in the Board of Medicine. And if nothing else, maybe this can help improve their standing. And I was kind of taken aback by that, to be honest. But this was coming from not medical people within our own committee. So,
So would our recommendation as a group then be that we would still want to consider the committee as a recommendation from 322? And it would be nice to hear from OPLC that gives us a little bit more information, but I still feel that a committee as structured, two, senators, 3 House of Representatives, would be very good to bring in the appropriate people from hospital, from providers, from Board of Medicine, and then come up with an understanding of process and any recommendations that follow after that.
The other thing too is that if it leaves the House with ought to pass and comes out of the House, it's also going to have a full hearing in the Senate. So we're going to have opportunities at that point in time to have the Senate weigh on it and have hearing at the Senate level. And if we hear all the things that we should hear, and it does look like it's going the right direction, the Senate at that point in time could vote to ITL it.
Right.
So I think at this point in time, to kill it this early in its journey is premature.
I agree.
I agree.
That makes sense to me too, because if it turns out to really be unnecessary, there are plenty of places to stop it along the way.
So, do we need to? Oh, go ahead.
So I'm not sure exactly what the process and what the procedure is going to be, but there's a couple of things I wanted to amend in the bill. I would like to consider 4 members of the House, 2 from the HHS, possibly 2 from ED&A, and 1 from each party to be sure this is nonpartisan, or at least bipartisan. 2 members from the Senate, but the other thing I picked up on was under line 15, where it says Association of Nurses. It should be Association, in my opinion, of Nurse Practitioners. They're the ones I think that really should be at the table versus nothing against the registered nurse, but they're not at the same level as far as hospital privileges and so forth you should have with a nurse practitioner. You could do both, yeah.
I think nurses in the hospital and healthcare setting,
They're the ones you ask.
they're the
The
ones
ones that ask, okay.
They get the scuttle. We all know
It's
they
true,
know what's going on.
they do.
So, no, I agree with you totally. And I think this is what I'm struggling with because this case was a hospital issue, but we're not just dealing with hospital issues. So I think, the only thing I'm struggling with as a husband of a nurse practitioner, and I really appreciate your support of nurse practitioners. One thing I've learned from this process is not overburdening committees with numbers. And, do we need to include PAs then too? That's what I'm getting at. Because there's a huge,
I look at the difference I see, Representative Nagel, is the fact that a nurse practitioner does have independent practice, and therefore the oversight is not there like you do with a PA. PA does have physician oversight, so therefore they're like each other, but they are fundamentally different.
But aren't they aren't regulated by the Board of Medicine. They're regulated by the Nursing Association.
Correct, but
So I don't mean that you wouldn't value their input, but it is a different, it is different as opposed to PAs who are supervised directly by us.
correct.
Physicians.
But back the same thing if you're in private practice, and sometimes this is hospital right now, but I think it needs to be broader than just the hospital. And therefore, if you have nurse practitioners out there on their own, then how does that get pulled into it? Because it's a separate type of practice setting. I do agree with what you're saying about the nurse inside of the hospital. They probably know more about what's going on than anyone else. But I want to be sure we don't somehow exclude the nurse practitioners in the process, because ultimately there could be issues there as well.
So my question would be then, because obviously you don't have a draft of that, would be, we'd want to just pass this on to the full committee, and then you could draft an amendment to be considered at the committee. So today, all we need to do really is just,
what were those recommendations or those changes that you wanted? I saw
Well,
4 House members.
4 House members, 2 from HHS and ENA, 2 from EDNA, because that's where the boards are, 1 from each party, majority and minority. And then in the Senate, it'd be 2 members from the Senate, and again, 1 from each party. Try to make this truly bipartisan.
Right, what, with each of the 2 committees,
Health and Human Services and Elderly Affairs,
yeah, and
and 2 from Executive Departments and
so
Administration.
one HHS person would be a Democrat, one a Republican, is that what you're saying?
Correct.
Okay. All right, gotcha.
And the same thing with the EDNA, and the same thing in the Senate, to be sure. And if you want to leave it with the Nursing Association, I think they definitely have a role here. But I think also nurse practitioners should be somehow identified as well.
Right, but if you leave it with the nursing association, then they could pick which they want.
They could, that's true, but I would be concerned that they would not pick a nurse practitioner.
I think you are totally correct, and I think you do need to specify if that's important.
Yeah. I know that that medicine in general has, we have to be careful that it's not looking like we're going to try to regulate nurse practitioners, because that's been a,
Representative Palmer, that's definitely been a point of contention. I think if we include the nurse practitioner, we can minimize that as well.
So my question is, with those changes, which are not really substantively, big changes, those changes that are not substantively, major changes, just making a change in the makeup of the committee, can that just go right to the committee for action? It doesn't have to have another public hearing or anything like that. Great. Great. Just want to make sure. Thank you.
So if I put through an amendment to 322 with the changes I talked about, can I ask you folks to co-sponsor the amendment? Thank you.
Sure. On 322. So will call this hearing closed. So then I need to know what I need to do. So I just fill this form out that we basically said ought to pass. Do I need to put any substantive discussion as to why we feel the way we do, or just circle ought to pass? And that there, oh. All right, and then the amendment part, do I need to put that in here too?
No.
That it was just, okay.
If someone goes to look at Bill record, they want to see what happened.
And then I fill this, I'll give it to you.
Yes. Usually the Karen, which.
Okay, either way, all right.